Good afternoon, and thank you for joining us. Today is Tuesday, December 21st, and on today's briefing, we'll hear from Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, Jaron Rausch, Health Officer and Director with the Greenfield Health Department, and Dr. Chad Craig, Chief Medical Officer with Ascension, Wisconsin. Thank you all for being here. And Mayor Barrett, I'll hand things over to you today.
Thank you very much, Catherine, and good afternoon, everyone. I think we all recognize that the situation is getting more serious rather than less serious, and that's happening not just locally, but throughout the state of Wisconsin. Wisconsin continues to have very, very high numbers. Unfortunately, we're among the leaders among states in a not a good way in terms of the number of cases that we're seeing. And we're also seeing that the Omicron variation is very, very quickly becoming the predominant strain of COVID-19 that we are seeing. With all of that in mind, I think it's important to note that we remain in the extreme transmission category for COVID-19 cases per 100,000. We are up to, and again, I hate that phrase, up to, but we are up to 340 cases per 100,000. In addition to that, our current positivity rate has increased to the extreme transmission category. We were not in the extreme transmission category previously, at least in this phase, but we are now at 12.6%. Our vaccination numbers have not really moved significantly at all. 60.6% of City of Milwaukee adults, that's individuals 16 or older, are fully vaccinated, and 65.7% of adults have received at least one dose. 30%, which is a number I'd like to see grow as well, are fully vaccinated with a booster. So here we are, a very, very important holiday week. And with the increased levels of disease burden in our community and the presence of the new variant, I want to make sure that everyone has a happy and equally important, safe holiday. That means get vaccinated, get boosted. While there is not enough time to have a full immune response to the vaccine in time for Christmas, it is still a level of protection. So please don't take your foot off the accelerator, or if it's not on the accelerator, get it on the accelerator. Get your family members to get their shots and also to get that booster. Anyone eligible to get their booster should prioritize doing so. That means those eligible who are anyone 16 and older, 6 months after the first dose of Pfizer and Moderna, or 2 months after the J&J vaccine. Again, this is a time where all families love to get together, where friends love to get together, but consider small gatherings with fully vaccinated friends and family. I'm seeing more people wear a mask. I think that's important, especially when indoors with people outside of your household and when traveling. So please, please guard yourself, guard your family, guard your friends, wear a mask if you're going out. Get tested. The PCR tests take 24 to 48 hours for results, so plan ahead. Only gather with those who test negative for COVID-19. Pretty fundamental, but it's worth saying. Only gather with those who test negative for COVID-19. And again, equally very, very fundamental, but it has to be said, stay home if you're positive for COVID-19. Stay home if you're feeling sick in any way. Stay home if you've come in close contact with someone who is positive for COVID-19. It is so important as we see this new variant get more and more steam that we do everything we can to stop the spread of the virus. So testing remains very, very important. And the Milwaukee Health Department COVID-19 testing and vaccination sites at the Northwest Health Center, Southside Health Center, and Menominee Valley will be closed Friday, Saturday, and Sunday, both holiday weekends. So on Christmas Eve, on New Year's Eve, they will be closed. On the Saturday, both Christmas and New Year's fall on a Saturday and the day after. So that's going to present a challenge, I think, for some. So if you need to get tested before the weekend, both this week and next week. In addition, no mobile vaccine clinics will take place between Friday, December 24th and Sunday, January 2nd. I do want to thank the incredible employees who have been working in these mobile vaccine clinics. They have been working tirelessly, as have all employees of our health department. And I think If you see someone who works for the Milwaukee Health Department, please give them a socially distant thanks. Let them know how much you appreciate the work they are doing. They are really, really out there for us because vaccinators and testers have been working 6 to 7 days a week since the beginning of the pandemic to provide response services to Milwaukee community. So we are very happy to provide them with some well-deserved time off to relax and recharge over the holidays. It has been a rough period for them. There are additional testing and vaccine locations that can be found at healthymke.com or at vaccines.gov. So take a look at that. We recommend you call the locations first to verify their hours, as many have different hours over the holidays. So again, as we head into this holiday weekend, I want people to stay safe. I want you to do everything you can so you don't get sick, so your family members don't get sick, so your friends and neighbors don't get sick. So please be safe, and thank you very much. And I'll turn it over to Dr. Weston, I believe.
All right, thank you, Mr. Mayor. Good afternoon. And as your time as mayor comes to a close, it's certainly been an honor working with you. Your partnership with the county, your deference and respect to a medical and a public health approach to the pandemic, and your engaged leadership has without a doubt saved lives over the last 21 months. So thank you for that and more. And I looked it up today. Luxembourg's vaccination rate is not too different from the United States. So you can bring some of that experience along with you and help to bump those rates up there.
Thanks. Thanks.
Yeah. All right. So first to our numbers. We're currently seeing in Milwaukee County an average of 472 new cases per day, and now rising about 6 deaths per day. That's a number of daily COVID deaths that we have not seen since just about 1 year ago. And as for our trends, that's an ongoing theme. We're just about exactly where we were a year ago with respect to cases, hospitalizations, as well as deaths. A year ago, as we went into the week of Christmas, we were seeing a decline in our overall disease burden. Similar level, but a decline. The difference this year is that we're on an incline, a dramatic incline that will be made even more prominent with the rise of Omicron. And I'll tell you, this is one of the more challenging briefings since we started them 21 months ago. This week should be a time for celebration, for gathering with family and friends, for joy. However, what we see in our community, in our state, in our hospitals is anything but. You know, there was an article in The Atlantic last week. It was titled, "Where I Live, No One Cares About COVID." It discussed that in the author's view, to a large extent outside of metropolitan areas, life continues as normal, without masks, without vaccines or boosters, without much concern for testing or distancing. And while I certainly realize that's the case, I'll admit it was a hard article to read. It was hard to read as COVID fills our hospitals with mostly unvaccinated people who alternately deeply regret their decision to forego the vaccine or deny the very illness that is making them sick. Hundreds in our county alone will spend the holidays in a hospital bed struggling to breathe, as they also struggle with the decisions they've made or not made that led to their hospitalization. And going into the holidays with cases at record levels and hospitals underwater, I worry about the unvaccinated as well as the vaccinated. For those who have not yet received the vaccine or have delayed the booster, I deeply hope that you don't get sick and that you don't unknowingly spread illness to grandma or grandpa across the table. But in far too many cases, you will get sick, if not this week, then in the weeks to come. And you will spread illness and people will suffer greatly because of it. But even for those who are vaccinated, I also hope that you don't get sick, though if from COVID, it would likely be more mild due to your protection from the vaccine. But I also worry that you may get sick in other ways. You may fall off the ladder putting up the lights. You may slip on the ice getting the newspaper, choke on your Christmas dinner, or have the inopportunely timed stroke or heart attack. Because if you do, no matter where you live, you will encounter an emergency department and a hospital that is full. You'll wait for a bed as nurses and doctors pick up the phone and call around to try to find another hospital that may have capacity to help you. And I can hear people saying, no, that's grim, but I can assure you that is our current reality. Look, I want to celebrate with my family, and I want you to be able to celebrate with yours. Many of us, most of us, don't get to gather nearly as much as we used to. We can gather, but we have to do so safely. And that means vaccine. That means boosters. That means everyone at the gathering taking a rapid test the morning of to make sure they're not positive. And if that rapid test is positive, stay home. Trust the test. A positive test is a positive test. This week and the weeks to come will be challenging for many. Our hospitals are at the breaking point, and with Omicron making up a substantial portion of new cases, likely the majority as we see updated sequencing, we have a flood of cases coming. We know Omicron is more transmissible. We do not yet know whether it's more or less severe. The data on that is still coming in. But we know that masking works, particularly high quality masking beyond the simple cloth mask. We know that vaccine works, especially when it's accompanied by a booster. And we know that testing works, PCR testing and rapid antigen testing. So use what we know works. Talk to your family and your friends and your neighbors, and help us as a community get through this week and what is to come. This is a time like no other to come together, to work together, to take these simple steps to protect not just yourself, but your community, your county, your state, and your country. Thank you, and I hope that you have a safe and happy holiday. And I'll hand it to Health Officer Roush.
Thank you very much, Dr. Weston. It's my pleasure to join today to provide a brief data update for the week. So when we look at our data this week, and Dr. Weston gave some great numbers earlier, 470 plus cases a day means that we're looking to face well over 3,300 cases in our next weekly report. And that's a lot of cases over a 7-day period. What I reflect on last week's data report that came out on Thursday was about 2,300 cases, and you can continue to see significant increases in both suburban communities and the city of Milwaukee, almost paralleling each other as we look at the whole population here. Now, as we look at kids, we see very similar increases, and we actually see for a time period where the suburban communities were almost as high as the city of Milwaukee in terms of kid cases under the age of 18. This has certainly been demonstrated in our schools, and we've seen this play out in other news stories that we've read about schools closing, shutting down, going virtual in some way, shape, or form, both in this area and in other parts of the country. What underscores a lot of our case increase is the things that we've been doing over the previous 2 weeks. So when we look at our reproductive number on this slide, we can see that in the previous 2 weeks, our reproductive number was way too high to suppress COVID-19 in our communities. We were seeing almost 1.5 as a transmission rate for a period of time just not that long ago, which means we're going to continue to see cases increase in the next couple of weeks at a minimum, and that doesn't include any potential holiday exposures that will come. When we look at the comparison between the city of Milwaukee and the Milwaukee suburbs, we see a very similar trend. And while the number right now, as it was calculated late last week, is slightly below 1, again, the history of what happened in the preceding days and weeks is really what drives cases. Vaccination efforts continue, and vaccination is certainly a very important mitigation strategy in this effort. And as I've pointed out previously, a lot of the vaccinations given more recently have been booster doses. And so it's great to see those individuals who've completed the primary series are now coming in for boosters. But even more importantly, we continue to see many people getting primary series vaccines, the first or second dose. And that's very important as well. And if you are one of those individuals who hasn't received your primary series, as Mayor Barrett mentioned before, getting it now will not give you full protection, but it will give you some level of protection, and that's better than nothing. The other way we'll look at vaccine series is also we're looking and tracking the cases here in green on the far right side of the screen. These are the cases, or excuse me, these are the vaccinations going to 5 to 11-year-olds. And this is very important because we've had now for almost 8 weeks a vaccine available to 5 to 11-year-olds, and those numbers are certainly going up. albeit maybe at a slower rate than we've seen with other population groups. So the slide here shows the percentage of Milwaukee County residents with at least one dose of any COVID vaccine. And you can see we're approaching about 20% of our 5 to 11-year-olds having received one dose. And that's significant, and certainly we'll see that continuing to increase in the coming weeks. Further, when we look at those residents who've been completely vaccinated, we see that a full 10%, maybe even just a little bit over 10% of kids 5 to 11 are vaccinated. Great news, but obviously to keep transmission in our schools, in our after-school programs, in our youth sports programs at a low level, we need to see that number go up even more. We need to get that number 50% and above, and we really need to focus on parents getting their kids vaccinated in that age group. Secondly, I'll continue to point out that we continue to see disparities in vaccination uptake. This is looking at completely vaccinated by race and ethnicity. And certainly we see all groups continuing to trend up, but we certainly see some gaps in terms of getting vaccination based on race and ethnicity. Lastly, today, I just wanted to end with some comments about prevention versus treatment. This kind of question comes in a lot to local health departments, probably comes into medical centers as well, and Dr. Weston may talk about this later in the Q&A portion. But the prevailing thought is, why do we want to prevent something if there's a treatment on the horizon? And yes, indeed, there are antiviral pills, there are monoclonal antibody treatments, but these are limited and they're not 100% effective. So I want to continue to point out, and echoing Dr. Weston, that we know what works. The prevention strategies, the vaccination plus boostering, wearing well-fitting masks indoors, testing if you have signs and symptoms, all of these things are very important. And continuing to echo Dr. Weston, we talked about how to have a safe holiday gathering, testing prior to the event, increasing ventilation, wearing masks as necessary. The prevention measures are going to be, by and large, more successful than anything that may come by way of treatment if you end up going to the hospital or seeking care. We know that the hospitals are overrun. We know that there are options there, but these treatments, even if they're 80 or 90% effective, the antivirals are not yet available. So it's not something that we even have at this moment, but even when they are, you need to seek care to get those antivirals, and that will be challenging. So I continue to focus everybody's attention on the preventive things that we can do to keep ourselves safe. And lastly, I just want to underscore, coupled with the dearth of cases and the dire situation in our Wisconsin hospitals, we're feeling the same thing in local health departments, both here in Milwaukee County, southeastern Wisconsin, and across the state. Those cases that get reported come to local public health for disease investigation and contact tracing. And in situations where we're getting thousands of cases a week here in the Milwaukee metro area, the contact tracing effort is magnified by probably at least a factor of 2 to 5, depending on how many contacts an individual positive case has. So we continue to do the good work of public health with disease investigation and contact tracing and health education as it comes to all of the cases, in addition to the vaccination efforts that public health and other members of the medical system are helping with throughout the area. So again, everything that you can do to keep yourself and your family safe helps not only the hospitals and healthcare systems, but also your local health departments to address the COVID situation more effectively. So with that, I will turn it back to Catherine.
Thank you, Director Rausch. We are now going to hear from Dr. Chad Craig with Ascension, Wisconsin.
Thanks, Catherine. Thanks, Darren. So I've worked for many years taking care of patients that are hospitalized for a variety of reasons. And I can tell you that all hospitals want for Christmas is for everyone to do their part to stay safe this year. All hospitals are struggling across Milwaukee, across our region. They're extremely busy. And you can help by doing a lot of the things that have been discussed so far that I want to really hammer home here. Getting your COVID-19 vaccination is first and foremost. It's extremely important for those that have yet to receive their vaccination. Getting your booster shot for those that are 16 and older. There's very good evidence that boosters help protect from severe COVID-19 and emerging evidence that it's helpful for protecting against infection related to Omicron as well. You can get more information about testing and vaccination at healthymke.com. You can put that in the chat as well, so everybody has that as a resource. Stay home if you don't feel well. It's really important to use your judgments when you're not feeling well, and don't put yourself around others, put them at risk. It is a good idea to get tested before holiday gatherings, as discussed by Dr. Watson and others here today. Wear a mask. Wear a mask when you're in public. Wear a mask if you're indoors, and especially if you're around others that are not vaccinated. Common sense things related just to COVID and influenza: wash your hands, socially distance when possible. These remain really fundamentally important to helping decrease the further spread of COVID in our community currently. I also want to make a few comments about emergency rooms. So we do not recommend going to the emergency room for COVID testing. You can find a trusted place to get dedicated testing, again, at healthymke.com. And this helps keep the emergency rooms available to people who really need them. And this is important because when people are experiencing a heart attack, a stroke, other mental health or acute illnesses, we want to remind people that the hospital emergency room is still the safest and most appropriate place to be going to get care. And we want to make sure that they continue to utilize this as a resource, go directly to the ER or dial 911. We increasingly are seeing people that are presenting later in their course of illness, and we want to prevent that. If you're not feeling well and the emergency room is not the most appropriate place for you, remember that a virtual visit is a good option across our region as well, to speak with a provider to help determine if you need to come in to be seen or not as well. What we really need is for everyone to lean in this season and do their part heading into the holiday season. We want people to celebrate safely. And again, I'll stress that of all these things we discussed, getting vaccinated and getting boosted for those that have not, the sooner, the better. I'll turn things back over to Catherine.
Thank you, Dr. Craig. We'll now move into the Q&A portion of our media briefing. We are seeing several questions in our chat, so thank you. Our first question we'll start with is from Michael Spalding with WTMJ Radio. It's for Mayor Barrett. He says, Chicago Mayor Lori Lightfoot signed a law making it mandatory for people to show proof of a vaccination to enter restaurants and entertainment venues in Chicago. Have you thought about doing the same? If not, what would Milwaukee's COVID situation have to look like for you to make that consideration?
Well, we have not done that yet in the city of Milwaukee, and I know that the mayor in Chicago has taken that action. I know in a number of cities, you're seeing that more and more often. Clearly, the trend we're seeing right now is not a favorable trend whatsoever. And I have every confidence in our health commissioner that she's going to step forth and work with our incoming acting mayor, Cavalier Johnson, to continue to monitor the situation. So I think if and when, and I hope we don't get to when, and we're getting unfortunately closer, we get to that point, I think that that's a decision that should be based on the science. If the health commissioner believes, looking at data from other communities, looking at the guidance from the CDC and the state, it's appropriate, I think that's something the city should consider. But again, I'm confident that both she and the acting mayor will look at this and base their decision on the science.
Thank you, Mayor. The next question is from Melissa Zygowitz with CBS 58. For any of our health experts on the line, she says, Wisconsin DHS reported the first child death today in Wisconsin in the 0 to 9 age group. What is your message to parents?
Well, I think we should never see a child death, no matter what it's from. COVID hasn't caused many deaths in children. It's relatively rare that it causes severe disease in children. It seems to cause long-term effects, a bit more common. But I think this brings home the point that when something's rare, it still happens. And when it's your child that it's happening to, it's not rare. It's affecting your family and it's affecting your child. We know there's a vaccine that's safe, it's effective, it's been given to thousands and thousands of children. In that young age group, people were worried about myocarditis. Last I looked, there hadn't been a single case of myocarditis and thousands of people vaccinated. It's an extremely safe vaccine and it's extremely effective in preventing something just like this. So the message to parents is simple. Get your kids vaccinated, get them protected. and take all the measures you can to keep them safe. They can still be in school, they can still be with friends, but they can be safe while they're doing it.
Our next question is from Chuck Kornbach with WUWM for Director Rausch. He says, what vaccine disparities stand out most to you, and how do we reduce that disparity?
Yeah, great question, Chuck. The way I look at the data in the vaccine report is that we're seeing disparities on 3 different levels that we can look at with the data we have available. First, we can see vaccine disparities by geography. We can look at seeing what's happening in the suburbs versus the city of Milwaukee. So just to give you a sense of that, Milwaukee County overall, our vaccination percentage is right around 56%. In the suburban communities, that number is nearly 66%. However, in the city of Milwaukee, that vaccination rate is 50%. So certainly we're seeing some areas and pockets of the county that are certainly not doing as well as others. Secondly, we can look at the disparities in vaccination by age. And as I shared moments ago, that 5 to 11 age group is still lagging, but of course, they've only been eligible for the vaccine for about 7-8 weeks at this point. So we'll continue to see that climb. All other age groups in our vaccination report are reflecting 50% or higher, which is certainly trending in the right direction. And it's certainly better than we've seen in previous months. And lastly, looking at race and ethnicity as the 3rd level of disparity. And while some population groups are certainly above 50%, we're seeing vaccination rates in the African American community at just under 40%. So we know there's some efforts that need to be made in those communities. And some of the ways that we can do that is to continue to be good messengers and good stewards of information. Reach out to family and friends and loved ones and share information about healthy MKE, share our experiences with vaccination, and really work to encourage others to get vaccinated or boosted if they haven't received their booster yet.
Our next question is for Dr. Weston from Ben Wagner with WISN 12. He says, based on the data you've seen, can you explain how contagious Omicron is? And is this one the most contagious virus we've seen?
So it certainly is the most contagious COVID variant we've seen. I think it's helpful to think of these as the 3 variants that we've seen. So there's the original strain, there was Delta, which is what we've been dealing with, and then of course, Omicron. So with the original strain, we talked about 6 feet of distance. We talked about 15 minutes of exposure. We talked about droplet spread. So it was this kind of close proximity sort of spread. You were around somebody for a little bit of a longer period, several minutes, and you could get infected. With Delta, the infectivity went up. So the amount of virus you needed in your body to get sick went down, and the virus was better at attaching to your cells. So that meant that we have more airborne transmission. So you're, on the other side of the room from somebody, you can still get infected, even within 6 feet for a shorter period of time, just a few minutes, you could get infected. Omicron seems to be substantially more infectious. When we look at the data, somewhere between 2 and even 10 times as infectious as Delta. So what that means when we see these cases is that if you're on one side of a restaurant and somebody we've even seen cases where you're in the next room at the restaurant, and because of the ventilation system, because of the way the air is moving, that virus is moving throughout that entire environment, and people are getting infected. So it's far more contagious, not just with close contact, but it makes that airborne aspect of it far easier to get as well. It's one of the most contagious viruses we've ever seen. Measles is maybe the only virus that's more contagious than it, and it might even be equal. But it also is much more contagious than any other COVID virus we've seen.
Our next question comes from Aaron Mabian with Fox 6. He asks, how soon before a holiday gathering is the best time to get tested? And what is the best advice if someone can't get to a testing site or can't find an at-home kit?
So for the rapid tests, there's no question about it. The day of is the best time to get tested. Do it that morning or a couple hours before the gathering. Those tests don't really aren't really good for much longer than that day. So certainly get it that morning. PCR tests are a little different because they take longer to come back. If you're getting a rapid PCR somewhere, certainly same day makes sense. But a lot of the PCRs in our community take a day or two to come back. So really, it's Tuesday. Today's the day to do it. Maybe tomorrow, if you can get it back in time for your gathering. So you want to get a PCR test a couple of days before so that you have the result during your gathering. And for the second part, the at-home kits are harder to find. They're still around. They're still in drugstores. You can call or you can search online, see who has them and who doesn't. There's a number of good tests out there. Most of the ones the main drugstores are carrying are good tests. They're going to detect the virus with a pretty high level of sensitivity. But if you have trouble finding at-home tests, there's lots of testing sites all around the county that are free. They're easy. A lot of them you can just walk in. So take a look on healthymke.com and you can find a site near you.
Our next question comes from Rich Revita with Milwaukee Magazine for the mayor. He says the NBA, NHL, NFL, college sports are facing huge challenges due to COVID-19. Games have been postponed or canceled. The Bucks are scheduled to host the Celtics on Christmas Day at Pfizer Forum. There is word today that the game scheduled for 1:30 p.m. could be moved to a different time. Has the city had any conversations with the Bucks regarding the current situation? And if so, what has been the focus of those conversations?
Well, the Bucks have been incredibly communicative with us throughout this entire 21 months. We've had great cooperation with them. We've had great cooperation with the Brewers and other sports teams as well. So I'm very, very pleased with that. I'm very, very thankful for our sports teams that they've been so cooperative. We have not yet had conversations with them about this Saturday's game. Obviously, if that's something that we need to be talking to them about, we will do so. Today is Tuesday, the game is Saturday. But again, I'm confident that we will be working closely with them and their management because that's the way we've handled this for the past 21 months.
Thank you, Mayor. Our next question is for Dr. Craig from Ben Wagner with WISN 12. He says, do you have specific numbers on how many of your hospitalized COVID patients are vaccinated versus unvaccinated?
Yeah, the short answer is the vast majority of patients that are hospitalized for COVID are unvaccinated. And we see this in our own market in Milwaukee. This is true nationally as well. It varies by site. It's extremely frustrating. I think it's extremely frustrating if you're a provider or a nurse caring for somebody who comes into the ER and you see how sick they are, and you know that we have the tools to help prevent this, and that those that are vaccinated are much less likely to come into the hospital. There are occasional people that come in that are vaccinated, and some of them get sick, but the chances of that happening are very low relative to your risk of getting sick and being hospitalized if you're unvaccinated. So the big important take-home point there is get vaccinated, get boosted, and you're much less likely to end up in the hospital, and you're much less likely to be very sick in the hospital as well.
A few more questions here for you, Dr. Craig. Follow up from Ben here. Belling Hospital in Green Bay is getting support from 20 U.S. Navy personnel. Have you requested assistance at Ascension, and or are you nearing a point where you need to call in support to help staff?
So all hospitals across our region, not just Ascension facilities, but all hospitals throughout Milwaukee are short-staffed and are experiencing the stresses of surging. And this is true with regards to other industries as well outside of healthcare. But yes, our organization is part of statewide planning and has been in communication with DHS, much as other organizations in our region have that I know. Regarding potential federal resources that have been requested by the state and gaining access to them when those can come our way. We certainly welcome any support that we can get.
Thank you. A few more questions here. The next one for Dr. Weston and Dr. Craig. The White House, from Mary Jo Oliva, TMJ4, the White House announced more measures to address COVID-19 this winter. What do you make of the steps they're taking? Is there an area that is lacking and needs more attention?
I can start here. So I think the information from the White House is coming out at the same time as our briefing. So I'm trying to follow along, but not seeing all of it. I'm certainly seeing that they're going to be having a program to send out more at-home rapid tests. I think that's going to be critical. Health Officer Roush talked earlier about equity issues, and that's a major equity issue. Home rapid tests are relatively inexpensive, but we're still talking $5, $10 a test, which excludes a large portion of our community and a vulnerable portion of our community. So having free at-home rapid tests, we've seen it work in a lot of different countries around the world. and hopefully we'll see it done effectively and work in the United States as well. I've also seen, I haven't read all the details, some talk about increased access to vaccination, and particularly to boosters. We know that that's a critical step with Omicron. And so getting as many people boosted, frankly, as quickly as we possibly can, as we see this wave of cases coming, is going to be really important as well.
I'm in the same boat as Dr. Weston, so I haven't yet to see the White House recommendations. So certainly welcome any all support from them, though.
Thank you both. The final question that I'm seeing in the chat is from Melissa Zygowitz with CBS 58. She's wondering, is there an update on how many cases are Omicron here in Milwaukee County?
I haven't seen an update lately. The Wisconsin State Lab of Hygiene keeps numbers on that, and we've seen cases coming in. There were recent reports of a large number of cases out of Dane County, but I think the trends that we're seeing nationally are that the spike in Omicron is happening at an extremely accelerated pace. That's what we saw in South Africa. That's what we've seen in Europe, in the UK, and in Denmark. And so there's no reason to think it's not what we're seeing here as well. I would imagine probably most of the new cases that are happening right now are Omicron throughout the country.
Thank you for the final update, Dr. Weston. Those are all of the questions we're seeing in the chat. So that does conclude our briefing for today. Just a reminder, there is no briefing next week. We will resume things in the new year. So thank you all for your time. Thank you, Mayor Barrett, for joining us again. And we will see you all in the new year.
Merry Christmas, everyone.
Merry Christmas, happy holidays. Take care.